wasn't aware of it. Is anyone here from DCF that might be able to give us a rundown of what that is and what its purpose?
Yes, sir. Hi, good morning. My name is Idris Gaines. I am the Northeast Regional Operations Manager for the Program Office of Substance Abuse and Mental Health with DCF. Just a quick overview of the regional collab. Um, it is a significant evolution of Florida's behavioral health strategy. With the implementation of House Bill 7021, the Department of Children and Families is acting on the Florida Commission on Mental Health and Substance Abuses 2024 recommendation to move beyond high level policy and address system challenges where they are felt most at the local level. These regional behavioral health interagency collaboratives are designed to strengthen community networks. They allow for the department to stay closely connected to local needs, ensuring that our strategies are not just statewide mandates, but they are more specifically tailored to the unique challenges and the opportunities within their specific regions. Now, we've already seen some of the fruits of this labor. Just yesterday at our Northeast Regional Collab, we had the opportunity of hearing a presentation from UCF Restores. UCF Restores provides specialized trauma support for first responders and our law enforcement partners. And it serves as a good example of the high impact evidence based partnerships that we are working to foster throughout the different regions. Now, to ensure that the network remains data driven, we conducted a survey of not just providers, but of the community and stakeholders. From the feedback from that survey, we identified three core work groups that we will be pushing out. Work group one is coordination of services. This group will tackle data sharing across systems, interregional collaboration, and improving general coordination between providers and co-responder units. Work group two, housing, transportation, and capacity. This group will prioritize transportation shortfalls and facility capacity. This group will also work in tandem with the coordination group to ensure resources are physically accessible to those in need, I should say. And then work group number three is systems policy issues. This group will address the broader structural hurdles that are present in our system of care. Now, this rolled out in 5 phases. First phase was information gathering. Uh, this stage was used to identify what are the service gaps across the regions. We identified those service gaps in our Northeast Regional Survey that was pushed out to providers and stakeholders. Phase number two was utilizing a statewide framework that we pushed out across the 6 regions that are representative in DCF. Phase number three was advancing the regional collabs. This is where we began to focus more on provider specific areas, specific providers within the regions that we could highlight and also discuss their services so that all the participants would be more aware of what is currently out there. Phase number four, strategic planning and system capacity. This is where we now start to look at what are the barriers, what are the hurdles, what are the issues within our system of care so that we can start identifying those and hopefully move forward with recommendations. And phase five was implementation and performance monitoring. This is where we go full circle, where we utilize the data that is gathered to then push out what those recommendations will be, not just for the specific regions, but also how we could roll those recommendations up across the state and then also push them back to the Florida Commission and eventually the legislature.
Sorry about that. Um, so that was a lot of information. I appreciate that, Mr. Gaines. How is it that you can, or that particular collaboration benefit Clay County? What is it that you're gonna need from the agencies here in Clay County?
So one of the things that we want to really look at is key to this whole endeavor is highlighting what are the barriers that are existent when it comes to people accessing services. whether that means, for example, let's say there is a high volume of individuals entering the jail system that have acute mental health needs. So, what are the barriers that are existent there that are preventing those individuals from being able to access services from a more preventative level or an intervention level so that they don't continue to penetrate the jail system when, unfortunately, as we all know, our jails and prisons serve the highest population of individuals with mental health needs that could potentially be diverted.
Yeah, absolutely. Well, you mentioned barriers, and that was one of the words I had written down and underlined. Could you possibly comment on, or are you involved or familiar with the multidisciplinary forensic team?
Yes, so DCF does fund those teams through our providers. So we fund a number of teams across the regions. For example, one of our major providers in our region is MHRC, Mental Health Resource Center. They have a number of forensic fact teams and our multidisciplinary teams. So these teams specialize for individuals who have high mental health needs, maybe possibly dual diagnosis as well, providing those wraparound supports and services within the community so that they can get the treatment that they need without having to be institutionalized.
Okay. And I hate putting you on the spot here, but with Clay County specifically, has there been any progress there in our local detention facility?
Not to my knowledge, but I can get that information and circle back to you.
Okay.
I do know recently that the department, DCF, has pushed out a number of grant opportunities for diversion-related programs in partnership with USF. So counties or providers can apply for those grants so that they can serve their specific populations.
Okay, all right. I appreciate that, Mr. Gaines. Does anyone have any questions or comments for Mr. Gaines? Okay, I don't see any. Thank you.
Right,
Thanks
thank
again.
you.
Appreciate that. And I saw a hand come up. Ma'am, would you mind providing whatever information that you might have to kind of answer the question I asked earlier?
Yes, I'm Katie. I'm the mental health counselor over at the jail. So I actually met with MHRC after our last meeting, and they have actually evaluated 4 inmates. Mr. Bell, I think one of you specifically asked about Mr. Bell. He
did,
was
yes.
evaluated, and he was actually accepted into it. And my understanding is he's doing pretty well so far. The other 3 didn't meet the criteria, but we are actively keeping in contact and going through the list for the state hospital to see who can be diverted to their program.
Okay, all right.
So yes, we're in contact.
I appreciate the update. Does anybody have any questions or comments for Katie? Okay, all right. Well, I guess we'll move on to the second order of business, is just a status update from the Clay County Jail. So Chief Arnold's more than capable of doing that.
Good morning. Our first quarter average daily population was 406 inmates. We have a total count as of today of 397. We're 81% of our maximum population currently. 82% of that inmate population are in for felony arrests, 18% for misdemeanor arrests. Currently, 82 are sentenced to the Clay County Jail, and 29 are sentenced to the Department of Corrections awaiting sentencing paperwork and transport.
It's been exactly 1 year since the judges and some other members of the community toured the jail. Has there been any kind of, I guess, improvements or not since then?
If you're speaking of structural improvements?
Yes, sir.
I mean, working with the space we have, we've been able to add small programs areas. The expansion is still underway, and we've been met with some significant challenges. It looks like we're going to be potentially reduced from 83 beds in that expansion to possibly only 20.
Wow.
So we're working on that to see what we can potentially do with the space. So,
Okay.
but no drastic improvements.
Okay. I just had a couple of questions about like work release and work crews and stuff like that, just out of my own curiosity and then, for the communities as well. Does the detention facility permit work crews?
Yes,
Has
we have,
work
we have
crews?
work crews, yes.
Okay, and what areas do they work in? What kind of work do they?
We have work crews that go out and do lawn maintenance throughout the county.
Okay, throughout the county?
Yeah.
Okay,
We do lawn maintenance. They maintain actually the courthouse grounds, the county gun range, and all of the Clay County Sheriff's Office buildings. We have a road crew that's contracted through the Board of County Commissioners that goes out and picks up trash on roadsides and cleans up debris. We also have in-house work crews that work within the facility with maintenance and things of that nature.
okay, all right. And then I know there's like an interior inside trustee program.
Correct.
Does that permit them to earn some kind of gain time?
Yes.
Okay. Are they incentivized to take advantage of some of the programs available in the jail? Do they get, other than the benefits they get from the programs that Ms. Atkinson directs, do they get any other kind of benefit from it?
No, we don't do any additional game time. Statutorily, we can only give up to 5 additional days of game time, which we give them for participating in the inmate work program.
Okay, all right. And I have been wanting to ask about the cell phones that are issued to the inmates. Has that, I'm just curious in general, has that improved the overall morale of the inmates in there, that they're able to at least be able to reach out and speak to family members or communicate with them instead of, waiting for a phone?
I think it creates a additional layer, more people can be on it at one time, rather than sitting around waiting. So yeah, I believe overall, yes, it has increased inmate morale. I mean, they have access to, programming on the tablets and things like that, and email, and they can text message back and forth with their families.
Okay. And I'm guessing that the increased inmate morale makes for a safer place
Overall, yes.
overall? Okay. I know that was asking you to generalize there, but, all right. Let's see. I don't think I have any other questions about that. Does anyone else have any questions or comments for Chief Arnold? Okay, all right. The next order of business, Ms. Pittenger, are you able to comment on the mental health programs in the jail if you're comfortable doing that now? I know I'm putting you on the spot. That would be Katie, okay, all right, I just thought you might want to say something. Okay, well, the star of the show, Ms. Atkinson.
I'll be giving out autographs after.
Yes, ma'am.
Good morning, everyone. Happy to report that this past quarter, we've had 3 men pass their GED. 5 men have received their certification in small business and entrepreneurship. The next semester for GED and Microsoft certification and small business is going to be starting on April 27th. We have 13 men that are enrolled in the GED program and 18 men enrolled in the Microsoft certification. I guess really what everybody wants to hear about is the Unlock Recovery Program.
Yes, ma'am.
Currently, there are 10 females that are in the Unlock Recovery Program with 4 females on the waiting list. There are 7 men in the Unlock Recovery with 38 men on the waiting list. Since the program started back in September, we have had 2 females who are very successful. They're living in sober living houses, they have jobs, they continue with their Vivitrol shots, and they continue with their aftercare with Clay Behavioral. We have had 1 female was released early due to completion of the program. We've had 4 men that have been released due to their completion of the program as well. 1 of them is living in a sober living house. And that's about all that I have, except that I would like to add a comment that I know last time we kind of talked about me getting a copy of the orders when the court orders them to take Unlock Recovery. I'm not getting them. And so I don't know, who's being
ordered, the inmates will say, oh, I'm ordered to take it, but, you know. And also, I know some attorneys have been recommending that their clients take the program as well, but I just need something so I know, to push these people forward and to get them moved up.
Okay,
Okay.
okay. I think we can
Okay,
have
Making a
our,
note. Making a note now to make sure I send this to you.
okay, thank
I'm
you very
sorry.
much. I appreciate that, sir. Thank you.
ma'am.
I hate to put you on the spot. I don't know the answer to this, why I'm asking. What's the capacity for, are there any halfway houses in Clay County? If so, what's the capacity? And how many individuals can
So
participate in that?
we don't have, I'm not sure what you're referring to as halfway houses. We do have sober living houses.
Or sober living houses?
Yeah, okay. So I think we have like maybe 4 through Oxford House. I think we have 4 of them. I think 2 of them are women and 2 are men. We have Recovery Road. They each have a house, male and female. And Richard Preston's, I don't know the name of his company, but he has, I think, 2 men houses and 1 female house. So that's all that we have currently. And then a transitional house will be opening up behind the jail on Pine Street. It's called Vineyard. He's hoping to open up in June or July, but that won't be just, that will not be sober living. It'll just be a transitional house for those who are coming out of the jail. He has 12 beds, 12 beds for men
Okay.
only.
Okay, there will be 12 beds in that building? Okay, it looks
Yes.
like the construction's kind of stalled there for a little bit,
yeah.
but it's still on track to open?
I just saw Pastor Sanders last week, and he said he's still on track, so.
Okay, all right. I guess 12 beds doesn't imply 12 bedrooms.
No, 6 bedrooms with 2 in each room.
Okay, all right. I
And just one other thing.
Sure.
I've updated my list of programs if anybody's interested in getting a copy of this, just so you know what we're doing in the jail.
I think we all should be interested.
Okay. Okay, well, thank you.
Thank you so much, Ms. Atkinson. Does anybody have any questions or comments? None? Okay, thank you very much.
Off the hook quickly.
Yes, ma'am. Is anyone from here, from the Department of Corrections here that might be able to give us like maybe an update from any programs that are available up and running? I don't see anybody from DOC here, so guess not. All right, well, I think that's really all that's on the agenda. I'll open the floor now if anyone has any questions or comments of me or anyone else on the committee.
I've got a question for the mental health specialist, Katie, right? So,
Excuse me, sir, who are you?
oh, sorry, Judge Forbes, County Court Judge. So, I know, I've been missing enough.
I'm just kidding.
I was supposed to be in trial this week, but then it went away, so. So I handle, I don't want to say all low-level crimes, but I've got an overwhelming majority of folks that are homeless. They commit crimes that are very, very low on the spectrum, meaning they normally get out very soon.
Like trespassing, a lot
Exactly.
of trespassing, yeah.
And I had a conversation with somebody on Tuesday, told him, hey, you're getting out. If you go back there, you're going to be arrested. I saw him the very next morning.
Mr. Douglas?
That would be him. So you're already aware. That's want to make sure.
Yeah,
So
yeah.
what is the process? Is it during intake when they're booked that you're notified?
Yes, usually when they're going through the intake with the nurses, if they're on, there's different criteria, but if they're on a mental health medication, if they've been there in the past and they have a history of seeing mental health, those kinds of things, they'll automatically send me a referral to
Okay.
put on their list, yeah.
Okay. Because I was just making sure, since it's such a quick turnover, I just wanted to make sure that they are still able to meet with you. And it sounds like you already knew the
Yeah.
name before I even
Now,
said it.
in
So.
the jail though, they have the option of refusing mental health services. So I still offer them. The guards will go and say, hey, you have an appointment with mental health. They have the option of refusing. With Mr. Douglas in particular, sometimes he does, but it depends on his compliance with his medication.
He's, I don't wanna-
Unfortunately,
I don't wanna
it's
say too much. He's
it's a-
always polite. He's very kind.
He is, yes.
I mean, he's, I've never had an issue one time with him
Yeah.
in court over 3.5 years, but it just,
Yeah.
I know he's
He is,
gonna,
he's very pleasant and
He's gonna go right back
taking
to
medication
McDonald's.
in the jail, like, but yeah, I know.
he's always polite in court. It's just, I'm trying to figure out what I can do to,
I was actually gonna ask, the thing is, he's not going to state hospital for competency or anything, but I was going to reach out to MHRC because they have the FACT program, which it's not the diversion, but a different one, to see if maybe it's something he could be considered
Okay.
for.
a-
Because
and-
he's homeless. I mean,
and-
I know
yeah,
he has family around, but I don't.
Yeah,
know
probation's not an option. It's
Yeah.
just, but jail, without getting in all the legal things, also, he really can't, he's been found incompetent numerous times. If I can just, we can do anything, but it sounds like you're already working on it, so.
Yeah, no, I'm very familiar with Mr. Douglas, so.
Yeah, like I said, he even told me in first appearance court, "You told me not to go back, sorry." I'm like, "I know, don't talk about your case," but,
Yeah, yeah.
okay, but you were already on
He's
top
on
of
my
it.
radar, yeah.
Okay, perfect.
Yep.
I just thought of another question for Ms. Atkinson. When you're not here like 6 months, you gotta get it all done.
We all learned floor is yours.
Why don't we offer the Batters Intervention Program or a similar program in the jail anymore? I never understood why that went away. I'm just curious.
Okay, so when I was promoted, I was not doing classes any longer. And I am the only person that is certified to teach that class. And I am bringing it back because I am seeing a lot of DVs coming through that jail. So I'm just trying to fit it into my schedule so I can offer the class
so-
because it is important.
Okay, and was my point, is I have folks that if they're on a violation status, if, rather than just sit in the jail and do nothing,
Right.
if I can order them as a part of their violation to complete the classes that we've already asked them to do. And sometimes I've given them more than one chance to get back out and do it, and they just never show up. But if I can court order them to do it, I think the Batters Intervention Program is extremely important on the majority of the cases. So I just never knew why it went away, but now I do, and it sounds like you're working to get it back, so.
Yes, I think it's a very important program as well. I am a survivor of domestic violence, so I know how important it is.
So-
And I do want to bring it back.
If you can just, I mean, I can get an update here, or if you just let my office know, the state attorney's office, public defender's office know that it is an option as soon as it's up and running, because that can significantly change in a positive way things that are happening.
I agree 100%.
Okay.
And yes, I will absolutely let you guys know.
That's the last question I have.
No, that was a great question, actually. I didn't realize that the program wasn't available anymore at the jail, so.
I think it used to be called the Doors Program. It was
No,
called
sir.
something different.
No, I called it Batters Intervention.
Okay, then I'm wrong. That's fine.
That's okay.
No, that's good. I just remember everybody was always saying, then they were like, that program went away. I'm like, why did it go away? But thank you. It sounds like it's coming back, which is
Yes, sir.
outstanding to hear.
It is, yeah.
Good.
Thank you. Yes, please.
I just thought about this. We used to get, well, I used to get copies of memos when inmates had been ordered competency evaluations in the jail. Is it possible when those are ordered that I can be just like copied on it so I'm kind of aware of, because not everybody gets referred to me, but it helps sometimes to be aware of who's needing those hearings just in case there's somebody maybe that I should be following or am already following.
Yeah, so just to clarify, when you're talking about like if a competency evaluation has been ordered on somebody that's in custody,
Right.
that you can just be clued in that
Yeah.
that's coming down the
Yes,
road in the
please.
doctor?
Yeah. Just to kind of make me aware of what's going on with the inmates.
Yeah, I
Because
don't
some of them I am seeing and some of them in the past, I was like, oh, I had no idea that they were even,
I don't see an issue. Judge Whittington,
would that be okay? Okay.
Yeah.
All right.
because
Thank
Judge
you.
Whittington and I are both doing all the criminal right now, so I mean, I know that I can do it in my division, and
Okay.
yeah, yes, we can include you.
Thank you.
I hesitate to close the floor now. Any other questions or comments? All right, well, I'll go ahead and adjourn the meeting. Well, prior to that, the next one is July 31st. Right.
My calendar has it on there, and I should be here July 31st.